People who have been infected by COVID-19 may have immunity to the virus for around 5 months. This is according to preliminary findings in a new study led by Public Health England, which has not yet been peer-reviewed. The study followed two groups of UK healthcare workers for up to 6 months. One of the workers had no evidence of previous infection, and the other had evidence of past infection. They concluded that past infection reduces the chance of catching the virus again by 83% for at least 5 months, but doesn't eliminate it. The researchers will continue to study antibody responses to infection and the impact of COVID-19 vaccines, while England is currently under a stringent national lockdown after cases surged over the holiday period. Researchers warn that the protection was not absolute, meaning some people do catch the virus again, and that it is unclear how long any immunity lasts. It is also possible that those who have a degree of immunity against the virus may still be able to carry the virus in their nose or throat, and therefore transmit it to others. Although we now know that most of those who have had the virus and develop antibodies are protected from reinfection, this is not total and do not yet know how long protection lasts. The SIREN research study regularly tested almost 21,000 health workers from across the UK between June and November of 2020. Among them, 6,614 people tested positive for antibodies against the virus, while more than 14,000 participants had no signs of previous infection. But of those who had been infected, 44 developed possible new infections, representing an 83% level of protection against reinfection. The study will continue to monitor healthcare workers for 12 months to see if protection lasts even longer, but for now, the length of protection identified means that people caught the virus in the first wave of infections may now be able to catch it again. We'll also look into the impact of the new variant and the effectiveness of COVID-19 vaccines. Studied patients were found with very high amounts of the virus in their nose and throat swabs that would easily be in the range, which would cause levels of transmission to other individuals, as we noted earlier. The SIREN study has major implications for how we can get out of the current crisis. The good news is that this study gives further weight that reinfections of COVID is rare, at least at this stage, and that having antibodies will provide protection for a meaningful amount of time, although it may not be lifelong immunity. The other news is that the vast majority of the population will either need to have natural immunity or have been immunized in order to fully lift restrictions on our lives. Because the results cover the months before the new variant took hold, it will be even of more importance to determine whether previous infection with the old virus variant is able to offer protection from reinfection with the new virus variant. Thank you for following along with our video. We hope you stay safe.